This week's content covers assessment of developmental stages and the essentials of baccalaureate education for professional nursing practice put out by the American Association of the Colleges of Nursing, also known as the AACN, which is the accrediting body of our nursing program and most baccalaureate programs in the country, states in Essential 9 that the baccalaureate graduate nurse is prepared to practice with patients, including individuals, families, groups, communities, and populations across the lifespan and across the continuum of healthcare environments. It also states that the baccalaureate graduate understands and respects the variations of care, the increased complexity and increased use of healthcare resources inherent in caring for patients. So I think that this sets the stage for why it's important for us to understand how to care for patients all across the lifespan. Understanding growth and development. It's essential for nurses. It enables us to provide care and support as our patients make inevitable transitions from one life stage to another. Our patients become more complex in their thinking and in their interactivity as they seek to maintain their health. From infancy through old age, each human experiences physical growth, psychosocial development, and cognitive development. To enable optimal growth and development, we as nurses need to provide to individuals, families, and communities information, anticipatory guidance, role modeling, and protection. This is a picture of Uri Bronfenbrenner's systems model of development. Uri Bronfenbrenner proposed a frequently cited systems model of psychosocial development, which describes the individual's development and interaction with the immediate environment. This model came out in 1979 and consists of nested ecological systems, as you can see in the photo. The individual, which is in the middle of the model, interacts primarily with the microsystem. The microsystem is the close, consistent, and immediate setting for the individual, such as for a child, family, school, spiritual community, and peers. The next level of the system is the mesosystem, and that interacts with the exosystem, extended family and neighbors, and the macrosystem, culture and ideologies, the chronosystem, environmental changes that occur over the life course. So this is an interactive system that allows us to follow an individual across their lifespan and see how all the different parts of their environment impact their growth and development. For Bronfenbrenner, 4 interrelated components: process, person, context, and time are important for nurses to consider as they examine development. This process, person, context, time model gives the nurse a way to conceptualize the developmental system and the way the person interacts with that system. One of your discussion questions this week asks you to use Bronfenbrenner's model to discuss a developmental consideration. This is how you should consider using this model, looking at the interactions of what's in the environment and how that is going to affect how you address a problem with your patient. Another model frequently used in terms of development is Erickson's model of individual development. It's a valuable model for viewing individual development over time and one that's used frequently in pediatrics. It involves the attainment of different qualities in each of 8 life stages. The first stage is trust versus mistrust. Infants gain trust when caregivers consistently meet their needs. They learn to trust that when they need something, somebody will be there. This is why we tell parents never to, quote, let a child cry it out, or if you answer your crying child, you will spoil them. It's wrong, because the opposite is true. If a parent leaves a child to cry it out and not go to them during a time of need, the child learns not to be trusting and to be constantly in fear of what could happen in their environment. The second stage is autonomy versus shame and doubt. Toddlers develop autonomy as they make simple choices and exert independent control. Preschoolers learn initiative, which is the third stage, initiative versus guilt, by engaging in cooperative projects with others. They need to learn how to play fair and how to lose. School-age children are in the stage of industry versus inferiority. They develop industry by acquiring skills that will assist them in adult roles and responsibilities. This is why projects at school, science fairs are so important for them. They're actually starting to work. Adolescents are dealing with identity crisis, identity versus role confusion. They achieve identity by establishing their own opinions, views, and ideas apart from their parents, peers, and other influences, and parents need to allow them to do this, obviously safely. Our role as nurses is to help educate parents on helping them to handle these different stages as their child progresses so that they can help them advance through them in a healthy way. Young adults are dealing with intimacy by fusing their identity with that of others. Middle adults attain generativity by sharing their knowledge with younger generations. And older adults achieve ego integrity through acceptance and pride in their life histories. When we're doing a subjective assessment across the lifespan, we're obviously going to include all of the things that we've talked about already: problems, family history, personal history, medications, etc. Because infants are pre-verbal and totally reliant on parents and guardians, the nurse must develop excellent observation skills and involve parents in assessment and care planning. Some questions you may ask, especially for the young infant, are related to the pregnancy, because for an infant, that's their past medical history. You may ask mother, were there any unusual circumstances or health problems during the pregnancy? What was the duration of your pregnancy? Labor and delivery? Did you have any anesthesia for labor? What was the baby's APGAR score? Did the baby require any resuscitation? What was the birth weight? Did the baby spend any time in the NICU? Has your baby had any infections, illnesses, or hospitalizations since birth? What about the well-child care the baby has received? And in addition, you need to assess for risk factors. Ask about how the baby sleeps. Make sure the baby's sleeping on their back. Does your baby fall asleep with a bottle? We know what the risks are for that in terms of dentition. Has the home been childproofed? Have you secured poisons? Is the infant in a car seat? Is it rear-facing? Do the parents know CPR? Additional risk factors include lead poisoning, tuberculosis. Find out if they've had their immunizations. If not, we need to find out why. Maybe they need better education about them. Talk about fire safety, water safety, outdoor safety. Has the child been taught to safely cross streets? Does the child wear a helmet for high-risk activities? Did they use sunscreen? Ask the older child or adolescent about drug and alcohol use. Sometimes we ask about their friends first so that they feel more comfortable answering. Then we would ask them if they've ever tried it. When we're assessing for risks associated with nutrition or obesity, sometimes we ask, what do you eat on an average day? We need to consider violence and suicide assessment, especially in today's culture. Ask children and teens whether they feel threatened at school. I ask, do you always feel safe at home? Do you always feel safe at school? When do you not feel safe? Ask them directly, here's my dog, ask them directly whether they've, sorry, Finny, whether they've thought about hurting themselves or others. And we have to include assessment about contraception and sexually transmitted infections. Ask the adolescent, do you engage in sex? What type of sex? Are you sexually active? Do you use protection? How many partners have you had? Etc. Healthcare decision-making for patients younger than 18 resides with parents and caregivers as well as the adolescents. Therefore, it's important that you involve both. However, some adolescents begin to seek care for themselves. Then sharing of information is less common. Legal consent for healthcare treatment is 18 years of age, but in most states, contraception treatment and treatment for STIs is permitted at 13 years of age. As a pediatric practitioner, I know that I never don't treat a child because I don't have the parent's consent. Most pediatric providers will always put the health care of the adolescent above involving the parent. If the child is engaging in sexual activity and refuses to discuss that with the parent, that is not a reason for me to not care for them. I will continue to encourage them to open the lines of communication with their parents, but their health is the priority. So if they seek out my services for contraception, even though I want them to tell their parents what they're doing, I will not treat them simply because they refuse that. And that is how most providers deal with adolescents. Health assessment of the child or adolescent also includes assessing for community support, environmental exposures, and potential opportunities for health promotion. For children and adolescents, health-related patient teaching focuses on healthy lifestyle choices, including nutrition and exercise. It also involves teaching about the avoidance of unhealthy habits, frequently acquired at early ages. Can you think of some? Smoking, drug use, violence. Additional information includes safety and the importance of emotional health and positive interpersonal relationships. You should assess how the child is doing in school. You should ask about friends, hobbies. Make sure you look at the health promotion goals on page 857 to 858. One potentially effective way to prevent young people from abusing substances is to explain how they interfere with the accomplishment of developmental tasks, which becomes difficult when the child or teen is impaired. For example, I frequently see young adolescents who are ready to start college, and we all know that for a lot of students, especially those that live at college, drinking is a big part of the college experience. It doesn't make sense to tell them not to drink because you know they're going to drink anyway. So what I try to do is help them to be healthy about it. I let them know that, for example, drinking and smoking pot at the same time is a risk because the pot takes away the nausea that would come from being drunk. And if someone drinks too much and then they take an antiemetic, then they don't have that safety mechanism that our body lets us know and vomit when we've had too much. So I tell them about that. I also tell them that when they're drunk, it interferes with their ability to make a safe decision, and that's a lot of times where kids get into a lot of trouble in terms of unprotected sex or risking their lives by jumping off the roof of buildings or out windows, etc. And sometimes you can point to situations that are in the media, like the rape case of the adolescent who was a well-respected jock who raped that girl while she was unconscious and drunk. Make sure we also discuss abstinence from sex, but we can't stop there because just encouraging abstinence does not necessarily mean a child will remain abstinent. So we have to discuss safe sex practices. We have to help our adolescents avoid high-risk behaviors. And we should answer all their questions regarding sexuality and sexual health and be open to all alternatives and all thoughts that they may be experiencing. Cultural considerations are important. Some cultural variations you might see are some families use certain home remedies to treat certain conditions. Ask about that. And if it's not harmful, just acknowledge it. But if a parent describes a harmful practice, then respectfully educate them about potential consequences. The nurse's role is to promote health and wellness in individuals and families. We support parents. We help our patients and families choose the healthiest lifestyles possible. We support adults in their healthy and safe choices. We want all of our patients to lead productive and satisfying lives. Review health goals on page 817. Rites of passage profoundly affect individual development. It's in many times a transition to adulthood. Let's think about some of the rites of passage in our own cultures and in our own families and what they meant to us. It can correlate with the considering of a child as adult, where they can be independent and make their own decisions. It sometimes informs when people retire. Some people retire very young, some retire old. It's how we look at ageism. What is an old person? Is someone old at 70 or not old until they're 90? Rites of passage affect adult intimate relationships in terms of cultural variations. It influences the roles and tasks of family members. The last slide of this presentation is the piece that I want you to be demonstrating in your discussion posts, that diagnostic reasoning, the nursing process, identifying problems as nursing diagnoses, for example, risk for delayed child development, readiness for enhanced family processes, or risk for impaired attachment, as well as others. What other nursing diagnoses can you think of? I hope this presentation helps you with your discussion assignment this week. Good luck.